Hi, I'm Kevin, and making this video because today an order goes into effect in Washington State requiring masks when you go anywhere if you can't maintain social distancing, and that is a good thing, and I'm going to do my best to try and explain why it is. Um, I ask that my family and friends please take the time to watch this or just listen to it. I know it's long. I know I don't have fancy graphics or anything like that. Um, and I've written some notes that I'll probably be referencing. But it's really important. So I ask that you please just take a moment and listen. I'm going to start off with briefly addressing this strange notion that requiring masks infringes on people's rights. Um, it's legally been passed by a duly elected governor. It's not been vetoed by the elected state legislator. It's not been deemed illegal by state judges. And that's because it's a temporary measure and it's being put in place for the safety of the state's citizens. It's to save lives in a global pandemic. There being a precedent for much more restrictive measures is odd that this is what's drawing attention, because in World War II, for instance, during the spring of 1942, a rationing program was established. It set limits on gas, on food and clothing that you could buy. Everybody was issued ration stamps in your family, which allowed them to buy their meat, their sugar, fat, butter, vegetables, and you got gas and tires and clothing, influencing what you could wear, and everything else. The U.S. is encouraging U.S. Americans to do with less so that the soldiers would have more on the front line, so they'd have enough. People went out individually and in their communities and did scrap drives to make armaments. And this was all, acceptable things because the country was in an extreme time dealing with extreme conditions of world war. But make no mistake, we are facing a world war now. Even President Trump has said he is a wartime president against an invisible enemy, referencing COVID-19. So, implementing a requirement to help slow the spread of the disease that is killing hundreds of thousands makes sense. Countries that implemented mask requirements earlier on have seen further reductions in their cases, because even if they aren't medical grade, a simple mask can still stop particulates from getting out and potentially getting in addition to stopping you from touching your face and instead touching the mask because it sticks to surfaces more than anything else, to helping stop spittle and things from potentially coughing or sneezing. But then, there's the minor stuff of breathing. Let's use a bit of an odd example. Let's say you and I are going for a walk, and I'm walking ahead of you, and for some reason I'm breathing a little heavily. Maybe I have a little cough or something, and I have COVID-19, but I don't know it. I haven't been tested because I'm not showing any symptoms yet, because they can take up to 2 weeks to start showing. So I'm walking ahead of you, and I'm breathing and maybe coughing a little bit, and there's stuff getting into the air. And then you're walking behind me. Now, it's in the air, so it gets dissipated, stuff falls, but they're still in the air, so there's still the potential that you could breathe in particulates. One of us is wearing a mask. It reduces the chance by filtering it, even if it's not medical grade. It reduces it. That's the key part. If we're both wearing masks, then it reduces it more. Me coughing or breathing out, the air, the spittle, anything else has to get through the mask going out. Then it has to be there long enough for you to walk into, for you to touch in any other form to not dissipate in the air. And then if you're wearing a mask, whether you touch it or you try to breathe it in, it has to get through your mask to get to you. Reverse is the same. Masks help. And unless you have a condition that reduces your ability to breathe while wearing one, in which case you should wear a face shield at least, you should be wearing one. So we'll go back to masks in a bit. Let's go on to the seriousness of COVID-19. If for some reason it's not quite clicked there for you, or maybe it has, and I'm just giving you some data. The influenza of 1918 is roughly estimated to have killed 675,000 people in the U.S. within 11 months. At the time, it was estimated the U.S. had a population of 105 million-ish. Worse than the number of U.S. deaths that we had in World War II. That was around 420,000 for the war. According to the 1940 U.S. Census, we had a population just over 132 million at the time. Recently, the 2010 census showed a population of over 308 million people. We have more than tripled since 1918. Additionally, we now have relatively cheap, very fast air travel, and it's expected for most people to have access or to own a car for short to long travel, or to use public transit. We're more connected than ever in the physical sense. This has resulted in a very mobile society where we can work further away, we can travel easier than ever. With more travel comes more exposure, and importantly, exposure to people outside of your immediate area and community. And those people you come in contact with also have exposure to other people in their community and outside of it. And you can follow that all over the place and quickly see how it snowballs and how fast contact goes really far, really fast. As of June 25th, the CDC estimates that the number of U.S. deaths was at 121,809 due to COVID-19 out of the 2,374,282 confirmed cases. For some reference and the wiggle room of these numbers, the provisional count as of June 25th, which is done by the National Center for Health Statistics, is based on death certificates. That's at 108,684, about 15-ish thousand difference in the numbers, and that difference exists because the initial estimates come from working with states and city hospitals reporting, because death certificates can take a while to process, and that slows down reporting and figuring out the numbers and tracking them as best we can as fast as possible is really important in trying to stop it and its spread, because if we can see where it is increasing and by how much, we can prepare and try to implement in those areas to slow it down. Let's compare those numbers to the worst flu season in recent years. 2017-2018 flu season, fall and winter, about 6 months, had 61,000 deaths in the U.S. COVID-19 has over 100,000. The flu season is about 6 months again, and it spreads through a large portion of the population. COVID-19 has been spreading in the U.S. for 4 months and has already killed more than 100,000 people in the strictest social distancing lockdown ever. Globally, it's killed 480,000 people, probably a lot more. The U.S. makes up 20% of the deaths from COVID-19 in the world, but we only have just over 4% of the world's population. Something isn't working. We're not going to go into that. What I want to focus on is that it's a serious disease. It's killing hundreds of thousands of people, and you should wear a mask to help slow it down, among other things. Let's talk about the age difference next. Generally, younger, healthy people have less to worry about based on the current data. However, yesterday, a 22-month-old little girl with no pre-existing conditions died from COVID-19 complications in a hospital in Tennessee. Relatively, it's an anomaly, as deaths of people under the age of 45 alone make up 4.5%-ish of deaths by COVID-19. But that's still the death of a child that could have been prevented, potentially. Based on the data coming out of New York, there isn't a significant change in your chances of dying if you contract the disease based on age until you get into the age range of 45 and older. People ages 45 to 64 made up 22.4% of deaths by COVID-19 in New York as of May 13th. A similar number, 24.9%, for those aged 65 to 74, and 75 and older had 48.7% of the deaths. Now, in perspective, U.S. citizens age 45 and up make up about 42% of the population, or 129,673,125 people are at a higher risk of death. So if you have a loved one in their 40s or older, they have a higher chance of dying if they contract it. A few other points just before I wrap things up. I know it's long. Thank you. Let's talk about the Sweden, a country that famously didn't shut down anything, is in just as much of an economic downturn as similar-sized countries in Europe. Denmark, a very similar country, which put in place some of the harshest restrictions, is in a nearly identical economic situation, a downturn, a crisis. The major difference between Sweden and Denmark is that Sweden's infection rate is almost double of Denmark's and has about 50 deaths per 100,000 people versus 10 deaths per 100,000 people. The simple thing is that most people don't want to go out in a pandemic, especially when there's a high death rate. That means that there's going to be less consumers. There's going to be people not buying as much, not able to buy as much. That's going to affect jobs and everything else, so on, affecting the economy. The lockdowns are meant to push the people who are willing to put other people at risk into being safe, because either way, there's going to be economic impact. Estimates indicate that countries who didn't lock down or did so very lightly or shortly will have a worse economic impact in the end because of the prolonging of the virus, meaning that people are going to be out less and still spending less and still not able to support jobs because the pandemic is still going. Yesterday, the U.S. surpassed its previously worst infection per day average, with more than 31,700 new cases in a day. We were crazy up, and then we managed to start flattening, and we have now surpassed our biggest point. Also yesterday, the Texas Medical Center in Houston reached capacity in its ICU, and case numbers are still rising. At our last peak, the country hadn't reached complete medical capacity, though some cities like New York had, and they needed additional emergency hospitals set up through things like the National Guard and the hospital ships, which helped us in flattening the curve and also getting those areas under control. We have very quickly gone from flattening the curve to increasing beyond the worst case we had, and numbers are still rising. When medical systems are taxed beyond capacity anywhere, deaths increase because we can't treat everyone. It's how we ended up with trucks full of bodies outside of hospitals, because the morgues ended up so full because the hospital was so full. And the terrifying possibility where we don't flatten the curve again at all, and the entire country, or enough of a portion of it, is sick at once that our medical system is overwhelmed. Millions of people will die. We won't have an economy because real looting and rioting will be everywhere as transportation, food, and every other system collapses because there's too much sick. On that note, I'm going to end with discussing at-risk individuals, something that's really important to me personally. Essentially, anyone with a negative effect on their immune system or lungs is confirmed to be at a much higher risk of complications arising if they contract COVID-19. I'm personally affected by this as I have some lung damage due to severe asthma. I had trouble controlling well into my teens. And then you have the more iffy, watery place of anything that puts a strain on your body in general and weakens it as a result. A weaker body, a tired body is more susceptible to illness in general. And so COVID has a higher chance of affecting you strongly and then things getting worse from there. And there are so many conditions that can do that to you that you can't name them all. It's hard to imagine. So I'm just going to give one example based on my experience. I have fibromyalgia. It's a chronic pain condition, which essentially boils down to mean that stress causes all of my nerves throughout my body to scream at my brain that something is wrong. My whole body feels a strange pain. There is no normal cause associated with it, so it doesn't feel like a cut. It's not really describable, and your brain gets overwhelmed with it. Well, all that pain, all that feeling tends to make you feel weaker and tired, among other effects. Weaker and tired means you're more susceptible to illnesses in general. From that, I've, asthma and everything else, always had trouble with the flu. It always hit me hard. But in the last 6 years since I got fibromyalgia, 8 years, I have been to the hospital twice for the flu alone because it got that severe. I've been twice for bronchitis and once for pneumonia. And I am a fairly careful person about just about everything in my life because of my conditions and experience. But they still, got to me through just spreading and being around people. Personally, COVID-19 scares the hell out of me. I don't think it makes me weak. I think it makes me strong because it's a natural thing to not want to die. And I'm admitting that it scares me and I don't want to die, and I want to do things to make sure I don't. And it doesn't just scare me because I could die from it if I contract it. It scares me because if I contract it, I could get my wife sick, my pets, my elderly parents, my brother. And a huge reason is, honestly, because you die by drowning in your own blood in really painful, awful way, and you can't have people with you because it's so contagious. And dying from suffocation has been one of my deepest fears since I was a child because of my asthma and breathing and all that. So it's really scary. If the numbers haven't convinced you of the seriousness of this disease, the situation we're in, and the need to slow its spreading however we can, I ask you to do it for me. Even if you're not coming into contact with me or those around me, you are probably coming into contact with someone who is at risk, be it from their age or some other condition. People like you and me are dying. Whether you have a condition, whether you're more susceptible or not, people are dying in droves. We're facing something that we haven't faced as a society on this scale ever. On every level, things will not be the same after this. You question the economy? The economy is going to tank no matter what. There is no easy solution to this. There is no pre-planned we have to adapt. What about your freedom to not wear a mask? Your freedoms as a human being in any country in the US only extends so far. You don't get to affect other people. The ideas of the freedoms and everything and the laws and criminality is that you don't negatively affect other people. It's fine. But in this pandemic, in this situation, temporarily, you have to wear a mask because you can negatively affect other people. You don't care if it affects you? Fine, that's your choice. But you could carry it and not know and affect somebody else, and they could die from that. So what about lives? Do you really not care about other people dying? Do you live in such a specific small world that the death of all these other people means less to you? We're in world-changing times, and I don't want to attack you. I'm not trying to come down on you. It sucks. It's world-shattering. There is no ifs, ands, or buts about it. But it's really important that we do what we can as individuals and together to try and combat it. And wearing a mask is the easiest thing that you can do to help with that. We have to adapt or things are only gonna get worse. So please wear a mask.